Hello and welcome to Med Simplified. Chronic joint pain caused by arthritis affects millions of people across the world every year. There are different types of arthritis, but in this video we will discuss one of the most common form of arthritis known as rheumatoid arthritis. We will talk about what is rheumatoid arthritis, what are the signs and symptoms you can develop if you have this disease, and how is RA diagnosed and what is its treatment. Hi, I am Dr. Umar Malik and let's begin. Rheumatoid arthritis is the most common form of autoimmune arthritis. It affects more than 1.3 million people in America every year alone. The disease most often begins between the ages of 30 and 50. However, rheumatoid arthritis can start at any age. Rheumatoid arthritis is an autoimmune disease. Autoimmune diseases include diseases like systemic lupus, multiple sclerosis, psoriasis, Sjogren's disease, etc. In these types of diseases, the body's own immune system attacks its own cells mistakenly and damages them. In rheumatoid arthritis, the body's immune system attacks the membranes that cover our joints, and these are known as the synovial membranes. Your immune system is supposed to attack foreign substances in your body, like bacteria and viruses, by creating inflammation. In an autoimmune disease, the immune system mistakenly sends inflammation to your own healthy tissue. The immune system creates a lot of inflammation that is sent to your joints, causing joint pain and swelling. If the inflammation remains present for a longer period of time, it can cause damage to the joint. This damage typically cannot be reversed once it occurs. The cause of rheumatoid arthritis is clearly not known. There is evidence that autoimmune conditions run in families. For instance, certain genes that you are born with can make you more likely to get rheumatoid arthritis. In rheumatoid arthritis, our own immune cells produce certain chemicals and antibodies that attack the synovial membranes of our joints, and this leads to swelling, pain, and stiffness in the joints. If this condition is not controlled in the early stages, it can cause damage to the joints that is permanent and not reversible. Rheumatoid arthritis typically affects the joints in your hands, wrists, knees, elbows, shoulders, and your ankles. The joints affected are usually symmetrical, meaning it affects the same joints on both sides of the body. This is an important factor that clinicians use to differentiate rheumatoid arthritis from osteoarthritis, which is another very common type of arthritis, but the joint pain in osteoarthritis is usually asymmetrical. Rheumatoid arthritis can also affect other organ systems in your body. About 40% of people who have rheumatoid arthritis also experience signs and symptoms that don't involve the joints. Other than joints, it can affect your eyes, your skin, the gastrointestinal tract. It can also affect the heart, the blood vessels, kidneys, and lungs. Before discussing about the signs and symptoms of rheumatoid arthritis, let's first take a look at some of the factors that increase the risk of rheumatoid arthritis. You have high risk of developing rheumatoid arthritis if you are aged 60 years or above, if you are a female, because females have higher risk of autoimmune diseases, if you have specific genetic traits for rheumatoid arthritis, if you are suffering from obesity. You also have higher risk of rheumatoid arthritis if you smoke tobacco or even your parents smoked tobacco when they were children. Rheumatoid arthritis symptoms are different for each person. Some people have long periods of remission with few or no symptoms. Others develop severe pain and stiffness episodes that can last from a few weeks to many months. New and earlier treatment is changing the overall picture of rheumatoid arthritis. More people are having low disease activity or even going into remission. Rheumatoid arthritis usually affects the hands and feet first, but it can occur in any joint. It usually involves the same joints on both sides of the body, like we discussed. Common symptoms include stiff joints, especially upon getting up in the morning or after sitting down for a while or after prolonged activity. Increased stiffness early in the morning is often a prominent feature of the disease and typically lasts for more than an hour. Gentle movements can relieve the pain in early stages of the disease. These signs help to distinguish rheumatoid arthritis from osteoarthritis. In osteoarthritis, early morning stiffness is less prominent. Your affected joints also become tender, meaning there is pain when you press your joints. The joints may feel warmer and may even have color changes related to inflammation, as they can seem a bit reddish. Rheumatoid arthritis can also cause generalized symptoms like fatigue, muscle pains, poor appetite, and a depressed mood. Now, like we discussed, rheumatoid arthritis can also affect several parts of your body other than your joints. Let's look at what signs and symptoms you can develop. If rheumatoid arthritis affects your skin, you can get rheumatoid nodules. These are bumps under your skin. Most of the time, they aren't painful, and they move easily when you touch them. About 1 in 4 people with rheumatoid arthritis get these skin bumps. They usually develop on your elbows, but they might show up on other bony areas like the underside of your forearm, your Achilles tendon, or the tendons in your hands. Rheumatoid arthritis can also damage your lungs or the membranes covering your lungs. This causes chest pain that worsens with breathing. Lung problems are the most common symptoms of rheumatoid arthritis outside the joints. You might notice shortness of breath upon minimal activity, or if rheumatoid arthritis remains active for a long time, it can cause pulmonary fibrosis, which is hard to treat condition that makes it tough to breathe. Likewise, rheumatoid arthritis can inflame the lining around your heart or your heart muscles. You probably wouldn't notice symptoms from that at first, but later on in life, there's a chance you could feel shortness of breath or sharp stabbing pain in the chest. It can also raise your risk of heart failure, atrial fibrillation, and stroke with age. Rheumatoid arthritis can also cause inflammation of your blood vessels. It can show up as spots on the skin or can also cause ulcers in more severe cases. So these were some of the signs and symptoms you can develop if you have rheumatoid arthritis. Your physician may order some lab tests to confirm the diagnosis of rheumatoid arthritis. These tests can include the erythrocyte sedimentation rate and C-reactive protein. Higher levels of ESR and CRP indicate excessive inflammation in the body. ANA or anti-nuclear antibody test and anti-CCP, also known as anti-cyclic citrullinated peptide test, are also done, which can indicate the diagnosis of rheumatoid arthritis. Rheumatoid factor antibody test is also done, which can indicate rheumatoid arthritis, but not everyone with rheumatoid arthritis tests positive for RA factor. An X-ray or MRI of a joint can help to identify what type of arthritis is present. X-rays can show how much joint damage you have, and MRI can give a more detailed picture of your joints. Apart from these specific tests, your doctor can also order basic tests like a complete blood count, kidney and liver function tests, as rheumatoid arthritis can affect multiple organs. Now let's discuss how is rheumatoid arthritis treated and how you can manage your symptoms on a daily basis if you have rheumatoid arthritis. Now, rheumatoid arthritis is a disease which has been present since ages, and many different types of treatments have been used in the history, but with incomplete results or even serious side effects. In 1897, a German chemist Felix Hoffmann started using acetyl salicylic acid or aspirin to treat various forms of arthritis. But taking aspirin for longer periods of time caused serious side effects like blood clotting disorders and stomach ulcers. In the 1930s, even injectable gold was used as a disease-modifying drug for rheumatoid arthritis. Gold showed some success with years of use and is still a component in a number of disease-modifying drugs used even today. But in today's modern era, the treatment of rheumatoid arthritis is much more developed with introduction of newer and safer disease-modifying drugs with few to no side effects. The first line of drugs that are used for the treatment of rheumatoid arthritis are known as non-steroidal anti-inflammatory drugs. These drugs include diclofenac, aceclofenac, ibuprofen, naproxen, indomethacin, etc. As you can tell by their name, these are anti-inflammatory drugs, meaning they decrease the inflammation or the swelling that occurs in the joints due to rheumatoid arthritis. This reduces the pain and tenderness and also helps in prevention of long-term damage to the joints. The second category of drugs that are used are steroids. These are used when you do not get a good relief from non-steroidal anti-inflammatory drugs or if you have advanced rheumatoid arthritis. Steroids reduce the pain and inflammation in the joints and can play a very important role in slowing down joint damage, but they cannot cure rheumatoid arthritis. Steroids are especially useful for acute symptoms or short-term flare-ups of rheumatoid arthritis. Long-term use of steroids can have serious side effects. These include cataracts, osteoporosis, glaucoma, diabetes mellitus, and obesity. The most important category of drugs that are used for treating rheumatoid arthritis are known as disease-modifying anti-rheumatic drugs, also known as DMARDs. DMARDs can slow the progression of rheumatoid arthritis and prevent permanent damage to the joints and other tissues by interfering with the overactive immune system. It is most effective if a person uses it in the early stages, but it can take from 4 to 6 months to fully experience the benefits. Some people may have to try different types of disease-modifying drugs before finding the most suitable one. The most common DMARDs that are used to treat rheumatoid arthritis include leflunomide, methotrexate, sulfasalazine, minocycline, and hydroxychloroquine. Side effects vary but may include liver damage, bone marrow suppression, and lung infections. And since these drugs have to be taken for lifetime, the side effects of these drugs can be a serious issue. That is why recently many newer types of drugs have been developed for treating rheumatoid arthritis. One such category of drugs are known as biologicals, also known as biologic response modifiers. Now, like we discussed, in rheumatoid arthritis, your immune cells produce certain chemicals that play a role in damaging your joint membranes, which lead to symptoms like pain, swelling, and tenderness. One such chemical is tumor necrosis factor alpha, also known as TNF alpha. TNF alpha causes the release of other inflammatory chemicals like interleukin 1 and interleukin 6. These interleukins in turn lead to more inflammation and bone and cartilage destruction. Therefore, drugs were developed which specifically target the TNF chemical, and these are known as anti-TNF alpha drugs. These include infliximab, adalimumab, and etanercept. Since these drugs lower the activity of your immune system, they increase the risk of infections. But these drugs do not have serious long-term side effects like most of the other medicines used for rheumatoid arthritis have. But these are costly and not everyone can afford them. Biological drugs are used most effectively when they are combined with a non-biological drug, such as methotrexate. One important thing to consider before starting biologicals is to test for a latent tuberculosis infection in your body, because these drugs can cause a latent infection to reactivate. Recently, a new class of disease-modifying drugs are being used for rheumatoid arthritis known as Janus kinase inhibitors or JAK inhibitors. If you have rheumatoid arthritis, your body makes too many proteins known as cytokines, which play an important role in inflammation. Some cytokines attach to receptors on immune cells and signal the immune cells to make even more cytokines. JAK inhibitors stop this process by blocking the messaging pathway. This lowers down your immune system activity and helps to decrease your RA symptoms. These include drugs like tofacitinib and baricitinib. Older drugs don't always work for everyone. Only about 65% of people who take disease-modifying anti-rheumatic drugs get relief from their symptoms. If you are not in this group, a JAK inhibitor might make a difference. In one study, about half of the people with rheumatoid arthritis who didn't improve with biological drugs had symptoms that were less severe after they took JAK inhibitors, tofacitinib, for 3 months. Another advantage of JAK inhibitors is that you can take them by mouth. You must inject biologicals such as adalimumab into your skin, while other disease-modifying drugs for rheumatoid arthritis are given intravenously into your bloodstream. But you can take JAK inhibitors as a pill. So this was about the medical treatment. Now let's take a look at some of the lifestyle modifications you need to implement if you have rheumatoid arthritis. Because lifestyle modifications like exercise and diet are very important to manage your symptoms and disease activity. Now for people with rheumatoid arthritis, exercise can be very beneficial for relieving pain and joint stiffness, and it can be particularly helpful during a flare of RA. People with rheumatoid arthritis who exercise regularly report that they have less pain than those who do not exercise. Exercise can reduce painful symptoms, improve joint function and flexibility. It also increases the range of motion and also boosts your mood. I will leave links to some of the useful videos and articles that explain what types of exercises you should perform and how to do them. Make sure to check them out in the description box down below. People with rheumatoid arthritis should avoid strenuous exercise or any exercise that causes joint pain. These may include high-impact exercises that put excessive strain on your joints. So friends, I hope you found this video helpful and informative. If you did, you can support Med Simplified by subscribing to our channel. You can also join our Patreon community where we share Patreon-only exclusive content like health tips, diet charts, behind the scenes of our videos and much more. Thank you so much for watching. See you in the next video.